Namaskar and a very warm welcome to this edition of COVID Live program Let's Talk Vaccine, Neuro Queries. I'm Nidhi Kumar and you're watching India Science. India's cumulative COVID-19 vaccination coverage exceeds 166 crores today. India reported 2.09918 lakh new COVID cases in the last 24 hours. More than 28 lakh vaccine doses have been administered in the last 24 hours and the recovery rate is at 94.37% as of today. As COVID-19 continues to surge in the country, COVID-related queries are on the go. People are speculating about their booster doses and the effects and what may come henceforth. In this program, we take your questions from Facebook and YouTube Live. And today we're joined by the very well-known, the very eminent Dr. Shashank Kale, Professor and HOD, Neurosurgery at the All India Institute of Medical Sciences. Many thanks for joining us today, sir. Please tell us, Doctor, something about this new variant and how you're seeing the trajectory different from Delta and what are your speculations about the same.
Well, can you hear me clearly?
Absolutely.
Okay. So this new variant that is speculated to be Omicron in most of the cases where people are getting infected in this wave. This new variant infection is much milder than what the earlier Delta variant was. The disease is shorter, the symptoms are less, people recover faster, and it does not affect the lungs. It usually affects the upper respiratory tract, the throat, the larynx. It causes some cough. It may cause fever for 1 or 2 days or maybe 3 days. And usually within a week, all these symptoms subside. Most patients do not develop any pneumonia or any infection of the lungs or any other serious complications. And most of the people recover very well at home and they usually do not need any hospitalization. So that's the good part about this Omicron variant infection, which is probably the most prominent in this third wave.
Yes, sir. And what are the effects of COVID on brain, sir? If I can ask you generally, because a lot of viewers want to know, are they more prone for COVID infection, neuro patients?
Yeah, so the COVID virus per se does not infect the brain cells. It mainly affects the respiratory tissues, that is in the throat or in the lungs or in the bronchus, the trachea. The earlier Delta variant affected the lung tissue, caused pneumonia as well, or changes in the lungs, visible on X-ray and CT scan. Thankfully, the Omicron doesn't. And the Omicron and the Delta both do not infect the brain cells. But because of its activity in the other parts of the body, it sometimes does affect the brain, the working of the brain. It causes a lot of fatigue. People feel a lot tired. There is loss of energy. Sometimes it leads to depression. And people who have comorbidities, like people who have diabetes or hypertension or the risk factors which cause strokes in patients, in such a group of patients, the COVID infection is probably precipitating incidences of stroke more than the normal people or more than the people if they did not have COVID. So it is precipitating events of stroke in the brain. It is causing depression. It is causing fatigue. It is causing difficulty in concentrating in their work. But thankfully, it is not infecting the brain cells and causing encephalitis or meningitis per se.
Yes, sir. Could you please explain to our viewers muscular dystrophy and motor neuron disease, as these affect both children and adults alike?
Yeah, so let's talk about the second one first, motor neuron disease. As you can surmise from the name itself, motor neuron disease. That means it affects the motor neurons of the human body. Now, the motor neurons are the ones which start usually in the spinal cord or in the upper part of the spinal cord where it joins the brain, which is called the brain stem. So it affects all the motor neurons, which actually lead to all the voluntary activities like speaking, walking, talking, using hands. Any activity involving voluntary muscles is controlled by motor neurons. So, this motor neuron disease, when it affects these neurons which control almost all the voluntary muscle activity of the body, that's when the patient starts having trouble like using his hands, writing, buttoning, unbuttoning, walking. And then, if it affects the higher motor neurons, there can be a problem in speaking, in swallowing, all kinds of problems. So, all motor neurons can be affected in motor neuron disease. That's what is for general people. That is, I think, a very good description of what motor neuron disease is. Usually affects the motor neurons, which is the lower part of the neurons, that is spinal cord and beyond that.
Yes, sir. On muscular dystrophy?
Yeah, muscular dystrophy is now how the nervous system controls the body is that the brain is the upper motor neuron. Then those upper motor neurons connect to the spinal cord, which is the lower motor neuron. And then these lower motor neurons go down to the individual muscles, say muscles which move the thumb or the fingers or the other hand, the feet, any part, tongue, the lips, face, eyes, anything which can move voluntarily is ultimately moved by the muscles. And these muscles are activated by the lower motor neurons. So the diseases which cause paralysis or weakness of these muscles can either be affectation of the upper motor neuron, the lower motor neuron, or directly the muscles. So all three can cause weakness or paralysis because ultimately the movement is caused by the muscles. So either the nerves which supply the muscles can become diseased and can cause weakness and paralysis, or the muscle themselves can have a disease and cause weakness and paralysis. So when it affects the muscle, we call it muscular problem, where muscular dystrophy is a kind of a muscular problem. And when it affects the lower motor neurons, we call it as motor neuron disease or ALS, as you know, amyotrophic lateral sclerosis. That's one type of motor neuron disease. In fact, it is the commonest type of motor neuron disease, which affects the patients and causes paralysis either of the hands or feet or both, or speaking or swallowing, the different kinds of diseases. The whole spectrum covers a lot of different types of motor neuron disease. So that is
Yes.
essentially the difference between motor neuron disease and muscular dystrophy. Muscular dystrophy affects the muscles, while motor neuron disease affects the lower motor neurons. That is ALS. That's the most common.
And we have lots and lots of questions pouring in from our viewers. The first one is, what is scoliosis?
Okay. So scoliosis means there is a deformity of the spine of the vertebral column. Just a minute, I'll show you. I don't know. Can you see this specimen?
Yes, absolutely. Yes.
Okay, so this is a specimen of the spine. This is the sacrum, and these are all the vertebrae. These are all the vertebrae, right
Yes.
up to the neck. This part is the neck. So if you look it from the front, this is how the vertebral column looks like. This is the front side. Now, when this scoliosis affects this vertebral column, it no longer remains straight, it becomes bent. It may bend like a C, or it may bend like an S, or it may bend like a reverse S or a reverse C. But essentially, what scoliosis means is this straight vertebral column gets bent sideways. That is scoliosis.
Right, doctor. Well explained. Please explain Parkinson's disease for the benefit of our viewers.
Okay. So, like I talked about the upper motor neuron, the lower motor neuron, and the muscles, this is the main pathway which controls all voluntary muscular activities of the body. The upper motor neuron, the lower motor neuron in the spine or in the vertebral column, in the spinal cord, and the muscles. Now, apart from this main pathway, there is a parallel pathway which is called an extrapyramidal system. Now, this controls the fine movement and coordination. If you have to move very small parts, the fine movements like stitching or sewing, or putting a button onto a coat, it involves a lot of fine movements of the hands. Now, these fine movements need some other control apart from this major control, which moves these big muscles, which you can make bend your elbow or raise above the arm. So the fine, which makes the muscle movement very smooth. If you have to do a complicated action like moving your hand, making it straight like this, and then making a fist. So there are 4 or 5 actions involved: this, straightening, and then making a fist. For example, a fielder in a cricket field, if he's diving to catch a ball, he's doing all these things. He's extending his elbow, he's moving his wrist, and he's holding the ball. So the extrapyramidal system makes everything coordinated and smooth. So otherwise it will appear very jerky, or staccato, but this extrapyramidal system makes everything smooth. So that's the function of the extrapyramidal system. Now, when this extrapyramidal system gets into trouble, there is a disease which affects it. It's called Parkinson's disease. So what happens in Parkinson's disease? The smoothness of this activity is gone. So you will see the patient is trembling. There is a tremor, or there is a tremor. The hands are continuously moving because there is no control. That fine control over these movements is gone. So essentially, what the extrapyramidal system disease, most common, and the one which you see people getting affected most commonly, is Parkinson's disease. And the most common thing you see in Parkinson's disease is this shaking of the hand, or trembling, or tremor. So that's essentially what is Parkinson's disease.
Yes, doctor. We have a question from one of our YouTube callers, Nisha Kumari, and she says that she's 1 month pregnant, and her doctor has advised her through go through a nerve conduction test and brain MRI to rule out multiple sclerosis. Is it safe to have the nerve conduction test done at a time during pregnancy?
Oh, yes, definitely. Both of these they have no threat to the fetus or to the developing baby. It does not involve any radiation. They're perfectly safe. You can undergo both the tests, MRI as well as nerve conduction, and it was not going to affect your pregnancy or the baby.
Okay, thank you, doctor, and thank you, Nisha, for joining us. I hope you got that answer right. And just explained Parkinson's disease. I would like you to throw some light on Alzheimer's disease as well.
Mhm. Now, Alzheimer's disease, a lot of research is going on even now as we talk in this world, but we still don't know a whole lot about Alzheimer's disease. Like, we don't know the exact reason why it happens. Are there environmental factors which are responsible? We don't know that. How important are genetic factors? We don't know that. Can you predict that this patient will get Alzheimer's when he becomes 75 or 65 years old? We don't know that. So we don't know a whole lot about the epidemiology of Alzheimer's disease. However, we do know that there is no exact treatment which can reverse Alzheimer's disease. So once it starts affecting the brain, it is usually a slow and progressive disease. Gradually, the function of the human body of the patient starts suffering. The memory starts losing. The patient starts losing his memory. The patient fails to recognize the environment, including the immediate family around him. The speech becomes disturbed. The voluntary activities become less. The patient usually lies quiet, not communicating, not speaking, fails to recognize his environment, fails to recognize his family members or the attention givers or caregivers. That is why, and what we do know is of the people who succumb to this disease, there have been multiple studies of the brain tissue and all of these patients who have succumbed to Alzheimer's. So they have identified the accumulation of certain materials inside the neurons or inside the cells of the brain. Probably they are somehow linked to this Alzheimer's disease, but we still don't know what causes the accumulation of these tau proteins, as they are called. Can we control it? Is there something which precipitates it? We still don't know a lot about Alzheimer's disease. All we know is that it affects usually after 55 or 60 years of age. It's a slowly progressive disease, and it affects memory and the function of the brain. That's what we do know.
Yes, doctor. Could you explain the connection or the relationship between, if any, between sleep disorders and multiple sclerosis?
Well, multiple sclerosis is a different kind of disease which affects the nerves. It usually affects the nerves. So, nerve bundles or nerves, they're present inside the brain as well, because ultimately the brain cells, they connect to the lower motor neurons and to the other parts of the body through nerve bundles. So, multiple sclerosis can affect in the brain or in the spinal cord, both places. So the manifestations of multiple sclerosis can be different. It can affect the eye nerve, or it can affect the cells in the brain, or it can affect the spinal cord and the lower motor neuron. So all kinds of different manifestations can occur in multiple sclerosis. Many times the multiple sclerosis is a self-limiting disease. It happens, say, in the eye, and the patient thinks, or it appears that the vision is diminished in one eye, and then after a good treatment of steroid or the pulse therapy of steroids, the vision improves, and the MRI changes which are seen. Multiple sclerosis can be picked up on MRI. So MRI changes, if they are seen, they reverse after the treatment, and the patient can become absolutely all right and remain all right for weeks or months or years together, and then have another bout, maybe in a different place, a different part of the brain, or the other eye, or the spinal cord affecting hands or feet. So multiple sclerosis can be a difficult disease. It can have relapses, it can have remittances. The patient can be absolutely all right for some time, or it can become a progressive, a chronic disease with significant changes affecting the human life.
Yes, doctor. We have another caller on YouTube, Shivam, and he writes in to us to say that his father got an attack 3 times and then he's suffering from neuro disorders. So, according to CT scan reports, his brain is degenerating and he forgets his location, persons, current events. Please tell us the solution and the medicine that, may be prescribed for him or some such. Uh,
Okay, so I understand, by attack there could be two things which I can understand. When a person says that there is an attack in the brain, that means some part of the brain has stopped working, just like a heart attack. There is a brain attack, which is also known as a stroke. So if his father has suffered three attacks, it could be that he has had strokes 3 times. Or an attack can also be an epileptic seizure. He can have a seizure and become unconscious. That can also be, many patients call that as an attack. So I don't know exactly what he means by the attack. But if it is a stroke, then it is best to get in touch with the nearest hospital, get in touch with a neurologist. They will probably get some scans done of the brain and try and find out how much of the brain activity, or how much of the brain cells, or how many brain cells have been affected. And if a significant number of brain cells have been affected, then there may be some deficits which may remain permanently. However, just on this short history and whatever the patient's relative has told us, it is difficult to gauge exactly what is going on, whether it was an epileptic seizure, which is called an attack, or he had strokes called an attack. Best would be to get in touch with a big hospital which has all the facilities, including a neurology department, so that they can look at your father, examine him, maybe do some tests, and find out exactly what is happening in the head, in the brain. And once they do a diagnosis, then maybe we can tell whether some treatment is needed, or he needs some help, or exactly how to go about trying to rehabilitate him if it is a stroke. But based upon this sketchy history, it's difficult to tell exactly what is going on. The best would be to get in touch with a good hospital and neurologist.
Yes, doctor. Another question that is coming to us again and yet again is how many kinds of sclerosis are there? There is a peripheral sclerosis and a amyotrophic lateral sclerosis. What is the difference? If you could please explain both of them, both these conditions.
Yeah. So, like I said, if you remember, in the probably as an answer to the one of the early questions, I had told you about how the brain and the spinal cord and the muscles, how they are connected. What is an upper motor neuron, which is in the brain, the lower motor neuron, usually in the spine, and then the muscles, which actually do all the activity. So when this sclerosis affects the upper motor neuron, it is called this PLS or progressive sclerosis. PSP, sometimes it is called, that is progressive supranuclear palsy. While if it affects the spinal cord and the lower motor neuron, then it is called amyotrophic lateral sclerosis. So the essential difference is ALS, that is the lateral sclerosis, it affects the lower motor neuron, usually the spinal cord and the other nerves which come out of it. While PSP or the supranuclear palsy, it affects the upper motor neuron. So essentially, that's the difference. PSP usually affects the upper motor neuron, may affect the eye muscles. ALS or the lateral sclerosis affects the spinal cord and usually the lower motor neuron. So I think essentially, if you remember these two, that would be fine.
Doctor, if you could also explain to us what a brain tumor means exactly. How do you diagnose a brain tumor and how do you treat it? I would like that in detail, sir.
Yeah. So the classical definition of tumor is whenever there is a growth of cells which is uncontrolled. I mean, the growth of cells in the human body is pretty well regulated. You see, the fingers have a particular shape, the bones have a shape, the nose, the eyes, the face, everything. There is a proportion and there is a optimum shape of everything. So, and that is controlled by the number of cells and the orientation of cells inside the body. But if in one particular place the cells start growing and there is no control over the growth, it will cause a swelling. It will cause a गांठ जिसको हिंदी में बोलते हैं. अगर ये गांठ दिमाग में हो जाए तो उसको ब्रेन ट्यूमर बोलते हैं. Essentially, it means that some cells in the brain are growing without any control. They don't seem to stop growing. They are multiplying one after the other. One leads to two, two leads to four, four leads to 16. They are in a geometrical progression, they are multiplying. And when this multiplication reaches a critical stage, it starts accumulating or appearing as a tumor, और हिंदी में जिसको बोलते हैं गांठ. So ये चीज जब दिमाग के अंदर होती है, when this tumor appears inside the skull, it is called a brain tumor. Now this brain tumor can affect different cells inside the brain. It can affect the glia cells, which are the small cells which are supporting cells for the neurons. Then it is called a glioma. It can affect the covering of the brain. The covering of the brain is called meninges. वो पतली सी झिल्ली की तरह होता है, which covers the entire brain. Now, when the tumor appears in these cells of this covering, it is called a meningioma. That way you can classify different types of brain tumors depending upon where has it originated. Has it originated in the glia cells? Then it is called a glioma. Or it has appeared in the meninges, then it is called a meningioma. So depending upon the cell of origin, we can classify these tumors with different names, depending upon the cell which gave rise to these tumors. So essentially, a brain tumor is a irresponsible and unregulated growth of cells inside the skull. Different types of cells may be responsible, leading to different types of brain tumors. That is what is a brain tumor.
Absolutely. Doctor, we have yet another YouTube caller. His name is Chandra and he writes in to say that due to COVID this year, especially in the month of April to July, he developed high blood pressure in his readings, and since then he's been taking medicines that cause many side effects. His doctor feels that the reason could be that COVID affected his neurosystem, since his ECG echo and stress echo is all fine. Is it possible for the nervous system to be affected? Is there any test to check this? And he also writes that his BP is 110/80, but when he sits up or stands, it shoots to 140. Is this connected with the brain, sir?
Well, in some instances, hypertension can be connected to the brain. That is why they say that decrease the stress, make a relaxed lifestyle, take out all the stressors in your life, eat well, remain healthy, exercise. So all that is supposed to reduce the stress levels in the body. Now, the stress levels can lead to different things. They can affect the brain, they can affect the heart, they can affect the whole body. They can affect the whole body. So, in COVID particularly, there is a term which has been coined, which is called long COVID. That is, the effect of COVID lasts for many months after the infection has cleared. It is called long COVID. And this long COVID is known to have many of these symptoms: fatigue, lack of concentration, increased stress, depression. Sometimes the blood pressure can also get increased. So all these things can be clubbed under that big umbrella diagnosis of long COVID. Many organs may be affected, or the different kinds of symptoms may be present in a patient, especially after recovering from COVID. And this is known as long COVID. Now, I don't know whether in this particular patient the blood pressure is because of long COVID, but I guess a good physician would definitely rule out other situations which can be threatening or life threatening. And once you're sure that there is no problem in the heart, there is nothing in the brain, there is no problem in the brain, and there is nothing problematic in the kidney, because all these can give rise to increased blood pressure. So once you have ruled out all the dangerous things, then you can safely say that, okay, maybe it is an effect of long COVID and things will gradually improve. But to maintain the blood sugar in the normal level, whatever may be the cause of the blood pressure, treatment needs to be given. So please follow your doctor's advice. The BP should remain normal, whatever the cause. Now, the cause can be deciphered after doing tests by a good physician, doctor, cardiologist, different groups of doctors. However, the essential treatment is to lower the blood pressure. For that, sometimes medicines are needed. So please don't stop medicines, at least on your own, unless the doctor has advised you to. Please continue taking the medicines so that your blood pressure remains normal until the time the doctors decide what is the cause of your hypertension and do we need to do something else. Thank you.
Yes, yes, doctor. One last question before we end this conversation for today. What is degenerative disc disease, and how can victims or patients of this disease, patients for this disease get rehabilitated and well?
Okay, so this question will be best answered by going back to our model of the spine. Can you see this?
Yes, thank you so much. Yes.
Yeah. So these yellow ones are the bones and the green ones are the discs. Do you see this green?
Yes, yes, doctor.
Yeah. So this green is like a padding. It's like a cushion. It's like a shock absorber. Can you see how it bends?
Yes,
Yeah.
absolutely.
So this green actually gets compressed because the bone is made of hard, tough calcium, while the disc is a soft structure. So that acts like a shock absorber. It takes all the load. It gets compressed, it relaxes, etc., etc. So essentially, what these green discs do is to take the load of the bones. It kind of takes all the load and it makes your back supple. You can do all the movements. You can bend forward, backward, sideways, etc., etc. So the structure of the disc is such that there is a lot of water present inside the cells and inside the structure of the disc. So there's a lot of water. That's what makes it soft. With advancing age, what happens is this water in these discs starts getting lesser and lesser and lesser, so that the softness of that disc disappears. It becomes harder. So it loses its shock absorbing capacity. Now, this loss of the moisture or loss of water content of the disc is called degeneration of the disc. And when it happens at multiple levels of discs, it is called degenerative disc disease. So, what happens in degenerative disc disease is the disc loses its shock absorbing capacity and the patient starts getting pain or his back starts getting stiff. That is essentially what is degenerative disc disease. Now, while aging is a normal process, everybody ages, I am going to age, you are going to age, everybody is going to age. Age is an advancing, it's just function of the time spent here in this world. As you spend more time, your age increases. And with age, all these things come. Your hair becomes white, your eyesight becomes a little weak, your hearing can become diminished, your skin can become wrinkled. All these is normal aging. Anybody who is advancing in age will have all these things. And similarly is the degeneration of the discs. Everybody will have it at some age or the other. Some
Right.
people have it at 80 years, some people have it at 70 years. So we don't call that a disease. That is part of normal aging.
Right, doctor.
But when this dehydration of the disc starts happening at a young age of, say, 30 years or 40 years, then it's a disease.
Right.
This should not happen at such a young age. And to stop that or to slow it down at least, there are different things which can be done. You should remain well hydrated, you should exercise well. Your core muscles, the muscles which are around the spinal cord or around the vertebral column, they should be strong. You should have regular exercise, good diet. You should have good amount of calcium in your diet so that your bones are strong. If you do all these things, then your bones and the muscles are going to be strong and your discs are not going to degenerate at a young age. So
Yes.
that's what you can do in your young age. Remain healthy, eat well, exercise regularly, maintain the muscle strength, and your discs will degenerate much slower and you won't have problems which you're having at 30. You should have at 80. You shouldn't have it at 40 years of age.
And on that note, very positive note, I'd like to thank you, Dr. Shashank Sharad Kale, for joining us and sparing your valuable time. And with this is the wrap of this edition of Question Hour. We'll be back with more interesting question hours in times to come. Until then, if you're not vaccinated, well, take the jab and stay safe and keep the mask up. On that note, namaskar. Many thanks for
Namaskar.
watching.